It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Thanks for being with us. Our next guest is Dr. Joel Weber, an orthopedic surgeon with Evergreen Health Orthopedic and Sports Care at Evergreen Health in Monroe, and his focus has been on sports medicine and minimally invasive arthroscopy of the knee and the shoulder. He's a Bellevue native. We're going to be talking to him about patella instability today, Shannon.
That's right, patella instability. It's a whole 2-day class. We're going to do it in like 10 minutes.
Okay.
It's a big topic.
All right, here's Dr. Joel Weber and Shannon O'Kelly on Como.
Dr. Weber, welcome to Health Talk. How are you?
I'm very well today. Thank you for having me.
Hey, I was looking at your bio. You're a local physician. You were born and raised in Bellevue, went to Eastside Catholic, spent some time at the University of Washington, and you made this this tour through the Pac-12 with an interest in sports medicine. Tell us about your practice and your interest in your practice.
That's absolutely right. I think my love for sports medicine started at the University of Washington. It grew with orthopedics through medical school, and I've just caught the fire at this point. So my practice is based mostly up in Monroe, Washington. I'm passionate about treating athletes of all ages from all walks of life. My goal is really to return people back to the activities they love. So I focus mostly on athletic injuries, mostly involving the shoulder and the knee.
Okay, let's talk about the knee. We're going to talk about patellar instability. And I know as a physical therapist, I've seen dislocated patellas, and I've seen them on the field acute. I mean, pretty painful and scary kind of injury for a lot of athletes, particularly young athletes. Let's talk about the anatomy of the patella or kneecap in the knee and how it functions and why it's such an important area.
Absolutely. So the patella or kneecap is a bone in the front of the knee, and it's a special type of bone. It's called a sesamoid bone, and these bones form within tendons. So the goal of this bone is to act as a fulcrum to basically increase the power of our quadricep muscle. So the kneecap usually sits in the front of the knee in a groove on the front of the femur bone, and that groove is called the trochlea. And with normal bending and straightening of the knee, the patella usually sits right in that groove. However, we run into problems when it slips out of that groove, and that's the diagnosis of patellar instability.
Patellar instability, the kneecap is slipping in and out of that groove. Instability means it just kind of is hypermobile or moves a lot in there. There are times where it actually dislocates. Maybe describe the difference between a slight subluxation, as we say, or a significant dislocation.
Correct, and that's the term we use in orthopedics is a subluxation, and that's just a subtle slip of the kneecap out of this groove where it doesn't completely pop out. Patients are usually a lot more familiar with shoulder dislocations, and so I kind of relate this condition to the shoulder, where the shoulder can slip out a little bit, but a complete dislocation is where it would pop out all the way out of that groove.
And particularly as we see young athletes, and it seems like they go through these growth spurts during that growth period of time, they're fairly susceptible. Their long bones are growing pretty fast. Maybe the muscles aren't keeping up as far as strength goes. They have some hypermobility at times. Maybe back in my day, we called it growing pains. Maybe talk about who do you see this in prominently?
Absolutely. This is a condition that plagues the pediatric population in kids. There's a lot of predisposing factors. So one you mentioned was laxity of the joints. So girls especially who have very lax joints, some people call it double jointed, are predisposed to this condition. There's also certain characteristics of a patient's anatomy, how the leg is aligned, where the kneecap sits, and basically how deep that groove is on the front of the femur bone can all play a role in leading to higher risk for this condition.
And if I just have hypermobility or patellofemoral syndrome, as we call it, maybe talk about some signs and symptoms there. I mean, what are these patients going to present to your office with?
Absolutely, and I think you mentioned this earlier. There's two flavors of patients we see. One is the traumatic injury. This is the football player, the baseball player who sustains a twisting injury, maybe a contact injury to the knee, where the kneecap traumatically pops out of the groove. The other flavor of patients is more of the subtle pain in front of the knee, a sense of something slipping or loose in front of the knee that occurs over and over again. This is kind of more of a chronic instability picture.
Dr. Weber, you're doing a fantastic job explaining a fairly complex situation. But in review, you have a patella instability, which the kneecap just kind of slips around, and then traumatically, sometimes it can dislocate. Two different things with two different factors that you need to see a physician for.
Correct. I think physicians can help in both instances here, and it's something that, through a thorough physical exam, we can usually figure it out and get to the bottom of it.
Once again, Dr. Joel Weber will continue our conversation about patella instability with Shannon O'Kelly right after this timeout on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Talking about the old kneecap, it's Dr. Joel Weber and Shannon O'Kelly as we continue our conversation on Como.
Dr. Weber, again, thank you for joining us. Patellofemoral instability, it's a huge topic. It's like its own universe, and we're going to cover it shortly here in treatment. So let's talk about treatment maybe for that hypermobile patellofemoral dysfunction, chondromalacia patient that you might see, and then we'll talk about that dislocation patient that you might see too. But let's talk about conservative treatment for just that hypermobile kneecap.
Absolutely. And again, this is a really broad topic, and the spectrum of disease is endless. So for somebody who's experiencing some subtle instability in the patella, non-operative treatment, specifically physical therapy, is crucial. So this is very effective, and often supplementing this with some sort of brace that can hold the kneecap in place is very important. Physical therapy is a specific type of therapy. The concept is called Patellar Tracking. So the goal is to strengthen the muscles that support the kneecap and keep the kneecap in the center of that groove. Not only at the knee, but also at the hip is very important to get these patients back to activities.
Great stuff on conservative care, but what about that patient that has that traumatic dislocation? Again, I've seen it on the field with athletes. It's scary. It's painful. The kneecap's out of that femoral trochlear you talked about, and it's very traumatic for that athlete.
Correct. For a traumatic dislocation, the first goal of treatment is to reduce the kneecap, is to get it back, and that sometimes takes a visit to the ER and some medication to sedate the patient. The next goal, obviously, is to evaluate the knee and make sure there wasn't a fracture, a break in the bone, or an injury to the cartilage when the kneecap slipped out of place and banged into the side of the femur. If there is an injury to the cartilage, sometimes this can be treated arthroscopically, repairing the cartilage. If these patients go on to have subsequent dislocations, more of a chronic instability picture, there's a multitude of different surgeries to address that, to prevent it from popping back out.
Tell us about the damage or potential damage as that kneecap pops out of that groove and it grinds on the side of the femur. You can damage that cartilage on the back side of the kneecap, which causes kind of a divot, if you will. And can you fix that?
Correct. You can fix a traumatic cartilage injury either by repairing the piece of cartilage back or replacing it through a bunch of different techniques. We do run into problems if we have multiple dislocations and the cartilage becomes more and more damaged. We start seeing an arthritis type picture behind the kneecap, which can go on to chronic pain and stiffness within these patients.
Can a piece of that cartilage ever break off and become a free body in that area that causes kind of a speed bump, if you will, or a impairment in tracking?
Correct. I like to call it a kind of pebble in the shoe phenomenon.
Yeah, right, yeah.
So if patients do have a loose piece of cartilage in the knee, it's usually a reason for us to go in there and remove it and obviously address that defect with a few different surgical techniques.
And now back to that conservative treatment for that hypermobile tracking or patellar dysfunction. Is there a surgical procedure, a good one in today's world, to intervene if conservative care, physical therapy does not work?
There's a bunch of different surgeries, and obviously there's even controversy in the orthopedic world about what is best. There are surgeries to tighten the ligaments to keep that kneecap tracking properly, or reconstruct them to try to keep the kneecap centered in the groove. It really depends on the underlying pathology that the patient has.
Dr. Weber, again, thank you for your time. Huge topic. You did a great job. Thank you.
Thank you. This has been fun.
Patella instability, issues with the kneecap, Shannon. It's something a lot of people go through.
A lot of kids, a lot of young athletes, and a lot of adults have it. It can be really kind of quite limiting in activity and function.
More information from Dr. Weber at evergreenhealthmonroe.com. Back with more after this on Como.